Now that the world has reached an age in which a 100-year life expectancy can be attained, GC Labs is connecting our humanity to a healthier life to provide you with a solution to maintain the quality of one's health. Through our ceaseless quest for perfection, we have built a total laboratory automation system. This system has drastically increased our testing capacity, enabling us to perfect our testing practices by achieving results much faster with a near-zero error rate. Importantly, our use of AI technology has allowed us to improve accuracy and speed up analyzing process. GC Labs' pursuit for uncomparable perfection, where no one has ever reached before. With performing more than 200 esoteric tests, GC Labs is securing a high percentage of repeat customers based and all around the world. And still, we are continuously expanding the areas of testing services such as NST, TB, allergy, genetic tests by enhancing our capabilities. At GC Labs, we have a team dedicated to next-generation sequencing. The team performs fast and accurate tests, making it possible to investigate numerous genetic mutations. GC Labs makes ceaseless innovation in testing capabilities. GC Labs has built a system that meets the entire scope of testing needs. Our total biologistics infrastructure features our specialized specimen collection center, transportation, and a monitoring system, ensuring to deliver all the specimens in an optimum condition. Our next-generation lab information system provides our customers with an improved and optimized experience. In addition to testing, our checkup center provides total health checkup services that are supported by state-of-the-art equipment and systems. GC Labs provides the best possible performance with complete holistic systems. Since its foundation, we have achieved numerous academic certifications, which have allowed us to offer only the best quality of services to our customers. Especially in our own infectious disease research center, it performs diagnostic research on infectious diseases, and it delivers education and international cooperation projects in relation to infectious diseases. In addition, as a member of the Global Diagnostics Network, a powerful global platform that covers 65% of the world's population, we are actively engaged in global health surveillance. GC Labs makes constant efforts for making better global health. The first, the best, and the biggest laboratory in health checkup and testing, GC Labs. GC Labs always connects your daily life to a healthy future.
Yes. Good afternoon, ladies and gentlemen. I'm Lee, the president of GC Labs and medical doctor, and I have been working for Greek Personal Laboratories for 33 years. Yeah, and I will share this workshop and co-chair with Mr. Valio. He will proceed the Q&A session. And this is a great pleasure for me to welcome you all to this workshop focused on the future diagnostic market evolution after the Covid-19 pandemic. The pandemic has led to unprecedented use of testing, and the scale and changes in the diagnostic settings generated a massive demand requiring new, simpler, faster, and cheaper technologies. Consequently, the diagnostics and testing landscape already in expansion before pandemic. And since exceptional quantitative growth, novel technologies, game-changing innovations in patient management, and new organizational model for pandemic control. And as a result of this growing demand, revenue and profits of companies operating in diagnostic space have also increased significantly. And after 2 years, COVID-19 is slowly easing, but because of the pandemic, the general public and health authorities have realized the importance of large-scale testing. Getting accurate test results within a short time is clearly top public health priority in order to prevent the spread of infectious diseases. At this point, some questions arise regarding the trajectory of the diagnostics and testing space. The questions are three. How will market evolve in different regions? And is it possible to predict the demand perspective? And how will government and private sector partner to strengthen national systems and prepare them for new challenges? To try to find some answers to these questions, we have gathered international experts from different regions and backgrounds to hear from them their perspectives and thoughts about this inflection point. So today we have, first of all, Professor Park. He is the Director of the Global Affairs of Korean Society for Laboratory Medicine and Professor of Songbin-Gak University School of Medicine. Please welcome. Mr. Kwang, here, over there, yeah, CEO of Quantometrics South Korea and Professor of Electrical and Computer Engineering of Seoul National University. Over there, Dr. Ko. Dr. Ko is the Director of Infectious Disease Research Center of GC Labs and a former executive board member of Untitled. Yeah, he's have a very long trip. So, President of Health for Development, South Africa, Johannesburg, and former CEO of Clinton Foundation. Co-chair, Mr. Mamora, he is a board member of Orange Technology of the United States of America and former CEO of Unity. Now, let me start by asking the first question to Dr. Barton. Question is, how do you see the diagnostic market evolution in Europe and Africa post-pandemic? Please.
Well, thanks very much, and thanks for having me. I'm loving it here in Seoul, and it's wonderful to see such a great attendance, such a magnificent event. I gotta say, I think we got a bigger crowd than they did, don't you?
Yeah, I think so.
Or over here, yeah.
That's right.
So when you talk about Africa versus Europe, it's actually more of a comparison than just a descriptor. And you actually have to look at the scale and the structural form of the two to really get a feel for what the base case is. In the European market, it's a highly organized market. It's a big volume, well-funded market, and it's a highly centralized laboratory system. Whereas in Africa, while we've got great growth rates, we're coming off a relatively low base, and it's a highly decentralized laboratory system and structure. The European IVD market is estimated to be about $15 billion this year and growing at about 5% per annum, up to about $19 billion by 2027. And that's largely driven by the growing geriatric population in that region. People are getting older, and as I am learning, older people get more things wrong with them. So the level and expenditure of interventions increases as the population shifts. Now, just listen to this number very carefully and perceive what it does to the hospital and clinical service systems. Today, it's estimated that 18.5% of people in Europe are over the age of 65. And that is anticipated to grow to 28.7% by the year 2080. So a 50% growth in the geriatric population over the next 50 years. And how do we respond to that as a health system? And within that population, both the lay population themselves and the professional population looking after them, there's a real understanding that the earlier you make diagnoses, the earlier you achieve interventions, the better the outcomes, the longer the life. And so people are seeking help earlier and looking for positive and predictable diagnostic interventions earlier. The best example of this is if one looks at what has happened in breast cancer management over the last 25 years. We've seen huge changes in survival rates, not just because we've invented much cleverer drugs, but because we're detecting malignancies far earlier and with a far greater specificity that allows targeted intervention to achieve the outcomes the patients are looking for. If you look at the African market in contrast to all of that, the biggest drivers of the IVD industry in the African market is infectious diseases and non-communicable diseases, specifically diabetes and cancer. And because of this lack of facility, the lack of structure, and the lack of centralized capacity, companies are focusing their efforts in on point-of-care testing and even self-testing at far lower costs. And they're doing that in collaboration both with governments and with non-profit organizations. The scale of market in Africa, estimated this year to be around about $3 billion, with a compound annual growth rate of about 4.7%. But obviously those numbers were far exceeded during the COVID period as a result of the direct intervention around COVID itself. The limits of growth in Africa are quite different to those in Europe. In Europe, stringent regulatory frameworks are a challenge, strong competition is a challenge. In the markets of Africa, it's more an issue of the complex regulatory getting into the market unpredictability, and obviously potential political instability.
Thank you, Dr. Barton, for your insights. Thank you. And Mr. Mamora, what about North America and Latin America without this point?
Thank you, Dr. Lee, for having us here. It's a real honor. North America dominates the IVD market, accounting for the largest share of 40% of the overall IVD global revenue. As Dr. Barton was pointing out, there are parallelisms between the North American market and the European market. In the North American market, we see a high level of decentralization with a strong prevalence of point-of-care technologies and self-tests. Today, we see that more than 18 over-the-counter COVID tests are approved by the FDA, our EUA, Emergency Use Authorization. And we also see that the IVD market will continue growing in the next few years. Today, the overall North American market is close to 40 billion value, with a growth rate of between 4 and 5%. Three driving factors. First of all, COVID, this unprecedented impact that COVID has had in terms of manufacturing capacity and investments, both from the private and from the public sector. The second element is the implementation of the Affordable Care Act, the ACA or Obamacare, with insurances covering many of the IVD tests. And the third one is, as in Europe, the rise in geriatric population with more awareness and more regular checkups on many therapeutic areas. In terms of opportunities, clearly the volume, the demand, and the affordability of new technologies and funding from the government and from the street, from the financial markets, of course. In terms of challenges, we see on one side pretty stringent regulatory framework and also the difficulty to access these funds that I was mentioning around. A common challenge between the North American market and the Latin American and the Caribbean market is the price of the equipment. We are talking about the PCR equipment that can go from $90,000 to $150,000, $180,000. Some unfavorable reimbursement scenarios that sometimes conspire against the growth of the market, and stringent regulatory frameworks. Latin America and the Caribbean also is expected to continue growing. Today it represents close to 6.5% of the total global market. In terms of improvements and opportunities, we see that the governments in Latin America are taking a more active and proactive role in terms of funding and covering the expenditures related to diagnostics. And in terms of challenges, sometimes we see some political instability or unpredictability in terms of the commercial environment.
Very informative, Mr. Manora. Appreciate your opinion. And Dr. Park, you have a special interest in the in vitro diagnostics market in Asia. So, what are your thoughts on the Asian market at this time?
Asian market is very diverse in nature, and the in vitro diagnostics market in Asia Pacific is expected to grow from US $14 billion in 2019 to $20 billion by 2027. It is estimated to grow at compound average growth rate of 5% from 2020 to 2027. 20 years ago, Japan was the biggest market in Asia, and many of the IVD companies classified Asian market as Japan and others, and Korea was in the area of others, China also. And Japanese market went flat due to mature market and aging population. Market could be divided into two factors: money and age of population. Aging population and lifestyle disease increases market size mildly in mature markets like Japan and Korea. In developing countries like Southeast Asia, market will grow fast according to the economic status until it gets to plateau. Let's talk about China. China is one of the world's largest and one of the fastest growing IVD markets. Thus, it is targeted by all major IVD companies and service providers for replacing some revenue lost due to slower growth in developed healthcare markets like Korea, Japan, or US. The global industry has increased activities here in the past decade, and companies not only sell IVD products, but also manufacture and distribute in China as well. In 2019, Chinese market for IVD reagents was estimated at approximately $4 billion. It's expected to show annual growth over 8% over the next 5 years. Now let's talk about Korean market. Market has been growing very fast for 25 to 30 years and now reaching almost $1 billion. Actually, it is around $900 million. And growth rate is reaching its plateau, which is less than 5% as Japan did before. Many local companies, including the biosensor and season made great strides in COVID pandemic situation, mostly on COVID molecular testing and POC testing. Major factors driving the market's growth include the growing burden of chronic disease, increasing use of point-of-care tests, diagnostics, and increasing awareness and acceptance of personalized medicine and companion diagnostics. And overall assessment of the market is rather optimistic. And I know like everyone in Korean population knows what EUA is. Do you know that? The Asian market is very heterogeneous in many ways. Some countries like Japan and Korea are entering already under the mature stage. Population is aging very fast in many parts of Asia. Japan, Korea, China, and even India is showing aging populations. But in some countries such as Vietnam, Australia, older countries will have higher cancer and lifestyle diseases such as coronary artery disease, diabetes, and etc. And the laboratory or healthcare services in more mature countries will be focused on central lab, and those in less developed countries on POC. Cost of molecular POC such as Cepheid and biometric could save money if used properly.
Thank you for your intuitive opinion and very summarized Asian market information. Thank you.